Hi there, and welcome to this, your 90-second key points summary of the fantastic webinar we've just had talking about 6-month reviews, part of a series of webinars by the Stroke Association and NHS England. My name is Richard Taunt from Kaleidoscope.
My name is Claire Upton. I'm a stroke support coordinator in the Fylde Coast working for the Stroke Association.
And Sam Stringer, National Stroke Programme, NHS England and Improvements.
Tracy Walker, I'm clinical lead for the Operational Delivery Network in Greater Manchester.
And one key point which stood out for me was a point you made at the beginning, which really stark, that I think 45% of stroke survivors at a point will feel that sense of abandonment. And so there's lots of optimism about the role of 6-month reviews and how they can make a positive change in that respect. But we're starting at quite a high level. And so wouldn't it be lovely if we were back here in a year or 2 years, actually having seen that figure come right the way down? Claire, what stood out for you?
So for me, it's important to know that it's not just a tick box exercise to meet our needs, it's to meet the needs of the stroke survivor and the carer. So what are their needs? Where have they come from? Where do they want to go in moving forwards? Listen to them, treat them as the expert in their recovery, but also facilitate them to be able to act on those needs and meet them needs for longer term support to aid the recovery.
Lovely, Claire, thanks. Sam.
And mine was that in meeting some of those needs, so atrial fibrillation and raised blood pressure, managing the risk of follow-on stroke, and meeting some of the needs that link to social care, in enabling people to return to some of their daily activities and take part in their community more. Actually, we know those are really cost-effective interventions as well that can have produce some real savings to the health and social care system. So it's a great intervention to meet their needs, but also a cost-effective one as well.
Lovely, great. Tracy?
Yeah, the big one for me is the challenge back to providers of the 6-month review to audit what the reviews are telling us. So everyone's got different tools, and you can use snap data, so to look at what are the unmet needs and what things do I need to change in my area and what do we need to look at following a review of the unmet needs of patients.
Thank you very much indeed. Thanks, Sam. Thank you, Claire. Just a reminder, if you haven't watched the full webinar, very much recommend it. Lots to take in there. Thanks very much for joining. Hope to see you at a future event. Goodbye.